The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead.
Welcome to Project Independence and You.
Good morning and welcome to Community Talk Radio. This is Project Independence and You on LIU Public Radio. I'm your host and producer, Kristina Liu, along with my co-host, Otto Los. Otto is a longtime volunteer, supporter, and friend of Project Independence, and more importantly, friend of mine. This is a very exciting show. This is our first show of 2025. So happy New Year to all of our listeners and watchers of the show. We're really excited to have so many wonderful guests coming up in 2025. And we are live on YouTube currently. So trying not to think too much about it, you know? Dan liked to spring that on us, and here we are.
As far as I go, it's just us.
It's just us hanging out, right? Yeah. Which can
maybe
get us into trouble, right?
And Dan doesn't like this, but maybe 30 or 40 people listening.
But this morning, we're starting off 2025 right. We have on Wendy Goidel, who's an Esquire, and Connie Wasserman, who is a social worker and the director of concierge care coordination at the Goidel Law Group. And we're talking about a really interesting topic, the intersection of elder law and social work, achieving safe and successful aging in place. So thank you, ladies, for joining us. No pressure to be our first show of 2025.
I was going to say that.
You're really kicking off our year. But this is such an important topic. And I remember a couple of months back seeing the article about your initiative and what you're doing with Adelphi and really combining the social workers and law. And we're clearly, not to be biased, but we love social workers on the show, right, Otto? And it's just, I think having that component to plan such difficult things is really, really special and unique. So we want to learn all about it. And Otto probably has a crazy list of questions.
I think a good start is how about just like a brief kindergarten overview of what does that really mean?
Exactly.
What's the point of the whole thing?
Sure. You want me to take it away?
Yes.
Okay. How much time do we have?
We got an hour.
That's why I did say the
I know, to
version.
kick it off. The kindergarten version. Yeah, it's a passion project. But I created concierge care coordination 10 years ago. This is we're in our 10th year anniversary of what we call CCC for short. And CCC is a holistic practice model, which integrates the best practices in geriatric social work with elder law. I mean, before 10 years ago, I worked as an attorney. I didn't have a social worker as a partner by my sidekick to assist our clients during the most difficult times in their lives. There's, that when our clients come to us with critical health and care needs, it's the social work piece that is at the front and center of our consultations, which we can talk about. So when a traditional attorney meets with a client, they're going to be talking about, the legal issues and strategies and solutions around documents, maybe about doing a Medicaid application, that component, because that's their focus. But when you're talking to clients who are having those health and care needs, it has to start with the health and care needs first. That drives the equation on the legal and the financial. So recognizing that there was a need for that, that's why I created this practice model.
So now I come to you and I'm going to have initial consultation. What might that be like? What would happen?
Okay, so you'll meet with both Wendy and I,
Right.
and I will actually start the conversation and start to ask the questions. What are your needs? What is it that you're looking for? So oftentimes people come to us and they're not even sure what they need. Yeah. They have medical issues. Perhaps an adult child is coming to because they have a parent in rehab and they don't know what the next step should be. So we want to know all of their medical needs, how they're functioning, where they're living. And then after starting to gather that information, I might make some recommendations or not, depending. Wendy then will start to ask questions that are driven by what their needs are.
Right.
And oftentimes by the end of that consultation, the individuals, the family members will leave there feeling as if a weight has been lifted off of their shoulders because they start to see that there are options for them. There is a possible plan for them. And our goal is to be able to keep that elder living as independently in the place that they want to reside for as long as possible, safely and with the appropriate supports.
Now, at that
Mhm.
point, do you create a plan of some kind, like a direction as to what maybe might take place here from several perspectives, really, the social part and the legal part?
So if they do retain us, Wendy will speak to the legal part, but what I will do is I will go into the home and do a full biopsychosocial home
Yeah,
assessment.
it just, when you hear about it, it just makes so much sense. And you're like,
Mhm.
how is this not just a standard practice across the board? Because having that, because it's they just join so well together.
Absolutely.
It's
How do we know if the home is safe for that
right,
person?
right.
What are the living conditions? What are their needs? How are they functioning? When adult children are dealing with changing medical needs of their parents, sometimes it's hard to accept the changes, and they're not even equipped to be able to sometimes take over
Yeah,
and make certain decisions. So when I do this full biopsychosocial home assessment, then I come back and I put together a care plan
yeah,
that I then
amazing.
send to them with referrals, recommendations, and they continue to work with me through the retention period, and I support them, help them. And then I won't go into the Medicaid or anything
Mhm.
like that, but then Wendy could speak to the legal
Mhm.
component that is happening parallel to what I'm
Mhm.
doing.
You can end up with people then who are healthy, people
Mhm.
who maybe just had a stroke, or maybe somebody just been declared with mild cognitive impairment
Correct.
or whatever. So every scenario, as I see it, would be very different.
Absolutely. There's
Right.
no cookie cutter approach to this.
Right,
We consider it person centered,
Yeah.
which is
right.
terminology in the social work
Right.
field, but it is also the
Yeah,
terminology in the legal
Right.
practice.
Whether you
of-
call it client-centered,
Yeah.
person-centered,
Yes.
it's
Mhm.
all about
Yeah.
that individual.
Mhm.
Yeah, there's nothing that's like Connie said, there's not cookie cutter. There's no one size approach to planning for individuals. Everybody is unique. Everybody's needs are unique. Everybody's families are different. Their assets are different. Their legal needs are different. So we really have to flesh all that out. And as an attorney, I couldn't possibly provide the right strategies and solutions and approach unless I really know all about that person and their family and their support system and what's going on, so that that care plan that's created is going to inform me. So
Yeah.
I know every step of the way what's going on with that individual from health and care needs. So going back to that initial consultation, we are spending up to 2 hours
Yeah, I could
with these
imagine. Yeah.
family members, really fleshing out everything first about their what's the presenting problem and where
Mhm.
are they, what are the goals? Do they need to come out of
Mhm.
rehab and go home?
Mhm.
What kind of appropriate care plan will we need to put in place for that to happen, so they can come out of a more restrictive care setting, right? Because our goal is safe
Right,
and
so
successful
yeah.
aging in place, right? We got to talk about all their activities of daily living and independent activities of daily living that they need to, that they need assistance with. And if they, sometimes we have that conversation and they think they're going to be Medicaid eligible, and we find out they really could do everything independently. They just
Mhm.
need maybe some companion care. They
Right.
need some help. So it's not going to be a Medicaid situation. And if you don't really investigate all that and have a full
Right.
conversation about that, we could be doing planning and making them spend money and go through hoops to get some benefits that they're really not
Just
entitled
don't,
to
right.
and get denied.
Right.
So if you don't have that, it could really be doing clients a disservice. So we're addressing all of that, and only when then we're really starting to kind of put that care plan in place.
Mhm.
Right there in that initial consult, in a sense, right? And kind
Right.
of going into the community and into their home is then going to better inform
Mhm.
Connie
Mhm.
and then us back in the
Right.
office about really what this looks like.
Well, you hit upon
Right.
one of my pet peeves, I think from before the show. You used the term Medicaid eligible. I know a lot of people who I've had conversation with that get frustrated because they really don't know if they're a realistic candidate for Medicaid, as an example. So a lot of times what happens is I guess the cart gets put before the horse, and you go trying to protect yourself from Medicaid, and there's not a prayer that you'll ever be able to get Medicaid. So, an evaluation of that, frankly, would to me be something you would get
Yeah,
involved
well,
with.
we do that right in that initial consultation,
Exactly.
because we're going to first educate our clients about the different programs that Medicaid offers. Community is usually the program that obviously we want to help our clients to become eligible for the most part, because we want them to be able to stay at home, right? But we're also going to educate them about institutional Medicaid in the event that
That it comes to that
it
point,
comes to
right.
that point sometime in the future. They
Yeah.
have to know how that works. So, but then we're going to analyze and examine their income from all sources and their assets. And we talk about the different thresholds that need to be met. But we have clients who have, let's say, husband and wife, and they were both retired school teachers, and they have pensions, and they have Social Security, and they have required minimum distributions from their retirement, and they have very high income. They're not going to be eligible probably for community Medicaid. And oftentimes, so there's nothing wrong with that. That's just the
Their
last payer source,
circumstance,
right?
But at
People
least-
could pay
Right.
for their care themselves. They could get VA benefits. Then sometimes they have long-term care insurance. So we have to examine all the different payer sources for care and what it looks like, and the pros and cons.
Yeah, but at least you know then that this is the real world, and this is where you should direct your efforts and your thinking about your money.
And we're
Frankly,
still working with them to help put the plan in place so that they can live as independently as possible, make recommendations. What are some of the things that they could do to their home to make them safer and more livable so that they could live there as long as possible? What are some of the things that they could become involved in within the community? I love Project Independence, as you know. You have services and resources here. So what can we connect them with so that they can continue to live independently? And another point about Medicaid that I think is really important is people think that Medicaid is only medical insurance Medicaid. No, what we're basically working with them on is community Medicaid. They're still going to stay on their Medicare and supplemental insurance. This is to bring care in the home.
well, another one you brought up, long-term care insurance. Unfortunately, I had the experience not too far back of thinking that somebody would qualify for long-term care insurance, but found out there's like 6 golden questions. And if you don't have 2 negatives to those 6 questions, you're not going to get any long-term care insurance. So I think even there, guidance with long-term care insurance, and is it really something that you're going to gain at this point in time? Do you meet you got your ADL and whatnot stuff here?
Right. There's a lot of factors that go into whether someone
They don't
really
give the
would
money away
qualify
too
for
quickly.
that. If our clients are coming in and they're relatively young and healthy, we'll bring it up as an option, right? Go to and see a qualified long-term care insurance specialist to see if it's something that works for you, right? There's no cost involved in exploring options, because those options will help us to figure out what's the best legal plan for you, right? Because if you're going to get the long-term care insurance, then maybe you don't need to do asset protection for Medicaid. But if you can't get the long-term care insurance, maybe it's something you want to do. So so oftentimes I'll say, okay, let's put a hold on this first. These are your different options, but go and get that information first, explore this first, and then come back to us. And then we'll look at
What you
other
just
options.
also gave me a picture of is
Right.
you're not just dealing with older people, you can deal with younger people who
Right, preparing for
Well,
we
their
want
future,
to.
yeah, right.
think like frankly, I've my own children. I talk to about this, and sometimes I tell them, maybe you ought to think about just putting money into something which is for your long-term care insurance, as opposed to buying insurance like I did and pay for 20 years. Never get it back. Frankly,
Right.
hopefully.
Well, there's kind of like 2 kinds of clients that we try to help. Those are who are planning proactively in
Right.
advance of a crisis, and that's
And those
where
are
we
in
want to
crisis,
focus
yeah.
on, right? And those
Right.
are in
in
crisis.
right.
Look, we can help both, but obviously we want to help people proactively because there's many more options. They can potentially protect all of their assets, right? They're making all the decisions. They're calling the shots. They're creating the documents. They're in the driver's seat. So there's much more that can be protected. And you know what? There's a lot less stress and frustration on the part of everybody in the family, as opposed to when someone's planning a crisis. Essentially, they could be the ones that are in the rehab facility or in a hospital. So they're not actually in our conference room meeting with us, whatnot, right? It's the family members or the agents. And then now they're scrambling to put a plan in place. There's fewer options, less that can be protected, and much more stress and frustration on the part of the family.
And I've experienced that because I'm with Wendy 3 years, and there are clients that come to us who worked with Wendy years and years ago. And now when they come to us and they need help, everything is so much easier to work with.
Right, because you have like a baseline backstory.
So I've seen it firsthand.
I've seen not too long ago, again, unfortunately, personal experience with a very, very good friend.
Well, Otto, you're going to have to hold that because we are taking a break. After the break, we will continue talking with Wendy Goidel and Connie Wasserman for the Goidel Law Group, all about how to intersect elder law and social work, achieving safe and successful aging in place. You're listening to Project Independence and You on LIU Public Radio.
So I get this call from my grandma, and she's like,
"What's a podcast and how much does it cost?"
So I tell her, podcasts are like radio shows, but you can download them on any device and listen to them anywhere at any time, and they're free. And then she says,
"I see, but where can you find good ones?"
And I'm like, go to wcwp.org/podcast and check out the lineup of original shows, or download any podcast app on your phone or tablet and search for LIU Studios. And she's all like,
"Oh, that sounds easy."
And then she asked me what an app is.
LIU Studios Podcasts, available on any podcast app. You know, those little button things on your phone screen. Just ask your grandkids.
Welcome back to Project Independence and You on LIU Public Radio. I'm your host, Kristina Liu, along with my co-host, Otto Los. We're going to jump right back in with Wendy Goidel, Esquire, and Connie Wasserman, social worker, LCSW, director of concierge care coordination at the Goidel Law Group, all about the intersection of elder law and social work, achieving safe and successful aging in place. So I know Otto is with bated breath, has the next question. I felt it. I felt the energy.
Chomping at the bit, right?
Well, I'm a big proponent of proactive versus reactive. Like even in the business world, it's better to not be firefighting. Do it when you can, but you can't always avoid it. I did have a personal experience not too long ago, actually, with a very good friend who had beginning stages of dementia, but all of a sudden went into a sundown experience and actually got pretty violent, and they had to call the police and the whole thing that goes along with it. And he didn't have a will. So at that point, they were in a crisis mode, and they had to go to people. We didn't know about you at the time, to try to figure out what to do now. So I just throw that one out to you. How do you visualize, like all of a sudden, boom, somebody just went through sundown. Where do I go? They're going to be put in lockdown somewhere. What happens after this? And
Well, the hope is that we can avoid that. And again, that's where I come in and meet with that individual and with the family to be able to better understand, assess what that person's needs are. Have they been seen by a geriatrician? Have they been seen by a specialist who deals with
in
dementia?
denial.
And that's where my work comes in, to help the family to understand the importance of that, because just because a person has dementia doesn't mean everything is gone.
Right.
Okay.
Right.
So I need to also work with Wendy to determine capacity. From a social work perspective, there's capacity, and from a legal perspective, there's capacity. Also, can this person be treated with medication? I'm not the physician,
Right.
but I'm going to connect them with the specialists in the field that might be able to help, so that we could keep this person in the least restrictive environment and get them the support they need. Is this person living alone? Is there anyone in the house supervising them? How do we get services in right away so that they can live safely without going into an institution? So these are all things I work with the family on to develop a plan. And then Wendy is going to look at what they need from a legal perspective. Do they have a power of attorney? And then I turn over to you because I'm not the attorney.
Oh, I thought she was going to do the legal
Well,
piece.
like-
She tries to do that. She
Like
tries to do that. all
The
the time.
wording you used about
Right.
services, whether it be in the house or institution, would you also get involved with, not that you're telling people they have to do this, but recommendations?
Absolutely.
Right.
I give a list of recommendations and referrals, and I don't give one, I give several so
Yeah.
that they have choices.
Mhm.
And I talk to them about why they need to start looking at this, because it's not easy. As you
Well, in that
indicated.
case, they had to take him out of the house.
Mhm.
So it was not a fun situation.
And sometimes they need to go into a hospital to be able to regulate medications, because when you're dealing with dementia, it isn't, again, one size fits all, that there's one medication to help with behaviors. So hopefully they could get the person on the right cocktail that they can then look
That's
at the
enough.
next steps.
You're hitting home here, because the cocktail was also part of the problem afterward. The wrong cocktail made it worse.
Yeah.
Okay.
And then they finally shifted to another cocktail and it got better. I mean, it's
Okay.
not going to ever get fixed, but it's,
But it's manageable.
yeah.
And that's what we're hoping to help the individual and their family live their best life.
But-
We're not curing anything. No one can at this particular point in time. But if we could make things the best that they could possibly be.
And then we go to
Quality,
you,
yeah.
Wendy.
But when you're
because-
working with, sorry.
Yeah,
but-
all of a sudden,
Yeah.
they don't have any legal paperwork. Now, how do you
True.
handle that when somebody is really not capable?
That's why the sooner we can address that situation, the
Right.
better, because there is the capacity issue. We have to determine whether that individual has the legal capacity, the requisite capacity to be able to make the decisions and execute the proper documentation. So we would go together and meet with the client, right, to assess that situation. And hopefully that person does have the requisite capacity and can sign. I know you mentioned that that individual didn't have a will, but what's really the most important document at that moment is a power of attorney,
Yeah.
right? And that's a part that a lot of, people in the medical field, not to be negative, but often understandably, they're going to focus on the healthcare proxy, the living will, those advanced directives, but we need to have a good, comprehensive, durable general power of attorney in place, which names agents who can step in and make legal and financial decisions for that individual when that individual can't make them for himself or herself, right? Without that document, we can't do anything really to put a plan in place.
Yeah, well,
And that requires, unfortunately, the guardianship, which is the worst case
Right.
scenario for anybody. So the sooner we can get in and the sooner people understand the importance of that minimum, having a power of attorney and a healthcare proxy, at least they have the agents who can act in their best interest and make those decisions for them. And then we can put a plan in place.
So a major message here is
You get your
be
power of attorney, right,
proactive.
yeah.
Oh, if you're going to, right.
Absolutely.
Make
You
sure
know,
you have all these papers.
Right. I mean, the will, while important, is really just determining who gets assets at death, right? So it does nothing for someone during lifetime. So everybody thinks, oh, I need a will, because that's what financial advisors and insurance
Hey, he doesn't
agents and
care. It's,
everybody
oh, my will,
understands about
right,
a will,
right.
but a will is just
Yeah.
a document that passes assets at death after a probate proceeding, right? So it doesn't give anybody any authority to act for someone during lifetime, and there's a much longer time we're going to be alive.
Of
than we're
course,
dead.
right.
And
So,
a power
right.
of attorney and healthcare proxy, you should be getting that at the age of 18.
Yes.
Okay. And it
Yeah.
should be reviewed every so many years,
Right.
because
Yep.
if you move, you have, your changes in your
Right, circumstances
marital status or
change, yeah.
circumstances. You may need to change
Or
it.
the person you gave the power to is no longer capable of
Exactly.
implementing
Exactly.
the power you
Exactly.
gave them.
Unfortunately,
Exactly.
a lot of documents we see that people have
They're
are just not outdated. They're not sufficient. They weren't done properly, or whatever the case may be. And that's the first thing I look at, right? Because that's going to, that is the most important document that will allow us to then step in when something happens. So, oftentimes we have to address that first and do a new document. And that will then allow us, if that person then unfortunately loses capacity, we can then, continue to work with
Right.
the agents and the family to put in that
I
care
will
plan
now
in place.
harass my 50-some-odd-year-old children to.
He said, now I have a task for the weekend. Yeah.
Exactly.
Now I have
Very
some weekend homework, right?
You know
Otto?
too much, Otto.
But you can harass, and that doesn't do anything. You
you're
got to
right.
do.
Right.
Well, it's a
people-
hard thing to drill home because, when you're younger, you're not thinking about that, right? You're like, oh, I have time.
Oh, you
What do
feel
I
you're
need to do
invincible.
that?
Yeah,
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 you really do.
yeah.
It is.
Anyone
Right. Of
at
course.
any age.
No, and I think
And
that's such an
that's,
important message
We
that
have
no matter what.
clients who are a lot younger. They have, young
Young
onset.
onset.
Right.
And, so this is not just talking about people who are older. It's
Yeah.
it's addressing anybody of any age who might have a chronic illness, comorbidities, neurodegenerative conditions. So it's not just not age
I
specific.
mean, I know young people who are doing very well for themselves. They're not married. They have no attachments. And they still need a power of attorney.
Yeah.
Because God
more so
forbid-
than
More
others.
so.
Right, right, right.
Absolutely.
You know?
Something happens, who's going to take care of everything?
Mhm.
Yes. Very
Yeah,
nice.
it's just-
Absolutely.
Yes.
It all, and was what we always say. Everything we talk about on the show, no matter what the topic is, it always comes back to planning, right? So it could be like any aspect of life, and that's always the important message. Is really how important it is to be proactive and to have these things, because nobody wants to deal with these things when you're in the crisis. It's a
So-
horrible
So
place to
let's
be
use the
in.
trite saying,
it's
failing
more
to plan is
difficult.
planning to fail. right?
Exactly.
And it's more difficult when you're in that crisis. Okay. It's much easier when things have been set in place ahead of time. Then there are more options available.
Another area, frankly, I mean, you're not a not-for-profit, all right? You're in this to make a living, which is part
She
of
likes
the-
to eat.
Yeah, well, it's part of the deal. I mean, and I'm not asking you to tell us exactly what this would cost, but how would you go about that part of it?
Sure. Yeah. No, fair question. It's a good question. There's so many different ways that we work with our clients. And I always go to like the value of the services that we provide and what the costs of not planning properly are. Right. So we have a lot of different ways that we work with our clients and a lot of different, packages and pricing. But for our concierge care coordination, we basically do it's an annual retention flat fee per year. So at the outset of our relationship with the client, that client and the family knows exactly what it's going to cost them to work with us. And everything that comes up during the course of that year is included. So
Wow,
that's
that's
unlimited phone calls,
Wow.
meetings, emails. We want our clients to reach out to us whenever anything happens, whenever there's a change, when there's an issue. We know that our clients' health and care needs can change on a dime. It doesn't there's nothing that just goes smoothly for an entire year, right?
That'd be great. If you could figure that one out, let
if
me
we
know.
could get her, keep everybody, well, that's Connie's job. I always joke with her, keep everybody
Yes,
healthy
Connie, let me know
and
when
going
you
and
get
right.
to it.
But we know there's going to be ups and downs. We know there's going to be changes in health and care needs. We know there's going to be changes with the aides that are coming into the home, or they need to look at other residential settings, or they're going to go in and out of care facilities, and we're following our clients along the continuum of care wherever they are. We want to keep them not falling into those gaps. So we created this program so that we can make sure that our clients know that they can call us at any time. They're not going to get a bill. Right.
Would some of that be?
Which is that in itself, I'll fall off my chair because that's normally not the typical
Exactly.
thing. It's any
They
phone
can
call.
call a licensed clinical social worker as many times as they need to through the year. So the person is living at home. We have a wonderful plan in place. They go into the hospital, then they go into rehab. Things have shifted. Now what? I work with them. I'll go to the care plan meeting with them. I will go to the discharge plan meeting with them. And we'll start to talk about next steps. And I'm there with them every step of the way, and there's no additional charge. It's all part of
the annual retention.
Right.
Now,
So-
would that also include like creation of a power of attorney, or would that be independent?
So we will create a plan that's customized for that individual. So sometimes that means the most comprehensive way that we work is it's all the social work for the year, the advocacy, the assessments, all the social work piece for the year. It's a Medicaid application, it's a pooled income trust, and it's all the estate planning documents or whatever the estate planning documents they need. Sometimes they may have done a trust 5 years ago and they don't need a trust. Maybe they just need a document here they're updated, whatever it is that they need. And we'll create
So
that.
you'll evaluate
We'll
the
evaluate
whole deal,
it.
and then you'll
We
say,
will then
here's
say,
the-
but all
Right.
I'll tell you is that when I bundle everything together, they're always getting a discount on my services. Always. I want to make it attractive so that they will want to work with us because I know the benefits. And you say I'm a nonprofit, but I do a lot of emotional billing. Right. So I could say like,
I know you put a social worker on staff,
right?
so I know.
I know. It's like, I know what you need. We know what you need. I want to work with you and your family. So I'm going to discount it. I'm going to make sure that you get what you want. Look, we can't do everything.
Of course.
We do some pro bono work and all that. Obviously, yes, we still have to pay the bills.
Yeah, I mean, real
And
world,
we do
I
fund a lot of
understand that.
nonprofit, philanthropy as well through the practice. So we do have to make some money, but that's the reality of living life on Long Island.
Certainly.
I want to age successfully too. But in all seriousness, when it's bundled together and it's all in-house, it's going to cost those families a lot less than if they go to the attorney. And maybe the attorney would say, okay, I can't do the social work piece. I'm gonna refer you out to an outside geriatric care manager social worker. Maybe they'll do that, and then they're gonna get a whole separate charges and fees for that. Maybe it's on an hourly basis. So
you can't even put a price on having like a collaboration situation, because I know, where I've worked with seniors for many years, and having these piecemeal things where A is not talking to B and C and D, and then it's so complicated and it's not really helping the person, and we're always talking about the circle of support.
Well,
right.
We are constantly in communication.
Yeah, and that is just so important, where we're the king and queen of it takes a village,
It absolutely
and
does.
especially when you're aging and life happens, to have all those pieces together.
And now I want you to think of something. Imagine someone is going through a crisis, medical issues, and they're meeting with the attorney who now gives them a referral to a social worker or geriatric care manager. Now that's another step. That's another task,
another phone call.
Thing they have to do,
which is extremely overwhelming.
Exactly. What we're trying to do is make it less overwhelming and simplify and streamline. And
well, that's the way I used to practice in the old days, right? And that's why I shifted it.
Well, that's what that's what kept popping in my head. What actually happened, Wendy, that you were like, you just like came up with like, listen, I'm going to need to have this concierge care social worker involved in this? What was like, was it just years of seeing like that need, or?
I think it's years of seeing the need. I used to think, oh, I'm compassionate, I'm empathetic, I'm inherently I feel like a social worker. It's like, no, I'm not. I don't have the education, the training. I can't, articulate everything. And so I used to do that. And I saw that it was fragmented. There's not that constant communication and collaboration. I don't know if my clients are actually taking my advice and calling this person. And you're losing a lot of valuable time, and people are not getting the right help that they need in the most critical times of their lives. And I'm starting to think out of the box and saying, like, there's got to be a better model. There's got to be a better way to do things. And I started researching, care coordination, collaborative models, medical legal partnerships, and all of this. And I said, you know what, this is what I want to do. I had a social worker in my office many years ago, but she did Medicaid applications. She wasn't Connie. She wasn't the kind of person who I could.
See, Connie, she wasn't Connie.
So she wasn't Connie. There's very few Connies. That's
very true.
But I have Connie. So just if you're out there, do not try to take Connie. Yes, I will. So that's why, to make a long story short, I created this model, and then it just we were able to hit the ground running and start to, provide all these services. And then, like, if you build it, they will come, the word gets out, and it's just like, it is just so much, it's so rewarding, because we really are able to see the difference that we can make in people's lives, not just the clients, but the family members, the support system. People would come to our offices, like, we kind of say, like, they're all stressed out, their shoulders are all up, like they're tense, and by the time that 2-hour consult ends, they're like, their shoulders are dropped.
Well, I'm not knocking the legal profession by any means. Right?
It's okay. You can. Everybody does. I do it too. It's fine.
But a lot of times it's treated like a very mechanical process, and it really, to the people who are on the receiving end, it's not quite so mechanical. There's a lot of emotion involved. There's a lot of thinking, like, if this daughter does this and that one does that, what's that going to do to the family? Whatever. And every scenario, I'm sure, is different. Suppose somebody wanted to go to you and say, I just want to know if I qualify for Medicaid. What would happen?
I don't know. I have no idea if you're going to qualify for Medicaid, because
no, I don't mean that. I mean the process.
The process. So we would talk to them about the process.
Right.
But
that's not your.
So when a potential client calls our office, we have our client services coordinator is asking a lot of questions in that initial call to be able to elicit what kind of consultation does this person really need, right? So, if someone just calls and says, oh, I need a trust, right? Maybe, if additional questions aren't asked, they may miss the point that there's already a diagnosis, right? So she's going to ask all these questions about, like, what's going on, where's mom and dad, or, are they at home? Are there any diagnoses? Because she's going to then determine whether this is a concierge care coordination initial consultation for both of us, or is this just like someone who's younger and healthier and just needs estate planning, and then that would just be for me. So really, sometimes we go into a consult and we might think it's one thing,
Yeah,
but it
and
ends up
something-
becoming
something.
so much greater.
Yes.
Or sometimes it's just an estate planning consultation, but then I find out, oh my God, I need Connie. I go knocking on her wall. It's right next to the conference.
She has
room,
like a special button that you press.
hopefully, like, Connie, I need you. Come in. And then it becomes the whole,
What about somebody, I'll use me personally,
Mhm.
right, who has a will, who has a power of attorney, who has a healthcare proxy, power of attorney, but they like the concept of what you do. Would you take that on as a client, or how
Sure.
would that work?
So there's kind of two sides of our
Mhm.
practice, and one is the straight estate planning for people who are younger and healthier, don't need the care coordination piece. But we have that very robust elder law side of the practice with the concierge care coordination model. So we can help both sides.
Okay.
So we can certainly help
Well,
you,
we're
Otto.
going to jump right back to Otto because I saw you ask another question. After the break, we will continue talking with Wendy Goidel and Connie Wasserman from the Goidel Law Group about the intersection of elder law and social work and achieving safe and successful aging in place. You're listening to Project Independence in You on LIU Public Radio.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
Welcome back to Project Independence in You on LIU Public Radio. I'm your host, Kristina Liu, along with my co-host, Otto Los, and we're jumping right back in with Wendy Goidel and Connie Wasserman from the Goidel Law Group, all about the intersection of elder law and social work, achieving safe and successful aging in place. And Otto, take it away. What did you have?
No, well, I had a question. You said the client service coordinator. In other words, when somebody called you, their first contact would be with a client service coordinator, which is not either one of you. So there are other people in your firm besides you two.
Thank
Correct.
God.
Yeah.
Correct. Yes.
Okay. And that's probably good, to be honest about it. You need backup.
You can't do everything.
No, exactly.
We couldn't
So-
provide the services we provide to
Yeah,
our clients if
of
we
course.
had to
Right,
wear
but
all the
you-
other hats in
Yeah.
the office.
Yeah, but you couldn't be doing what you were talking about doing
Correct.
for everybody.
Right.
You just wouldn't have enough hours in the day, in my opinion. So you not wind up, but you talk with a client service coordinator. And frankly, it may be simple enough that neither one of you may ever get involved. It could go to somebody else, or will it always?
It will always go to one or both of us.
Right.
And then, we would bring on other
Mhm.
individuals. So if there is
Okay.
Medicaid involved, we have a Medicaid coordinator, and she does, she navigates the clients through the whole Medicaid process and representing our clients through, in front of the Department of Social Services. And she prepares the Medicaid applications and the pooled income trusts and whatnot. So that is a job in and of itself.
And that's all being
right.
worked on parallel tracks.
Right.
So while I'm doing the biopsychosocial assessment, writing up the care plan, the
Right.
Medicaid coordinator is beginning the Medicaid process. Wendy is working on the legal pieces. So
Yeah.
we're working on parallel tracks to get everything together in the most timely, efficient way possible.
Right. And that's assuming at that point that this person's qualified
Correct.
for Medicaid and they
Correct.
have a need to do it now.
Right.
Uh,
Or helping
Whereas
them
if
to
I'm
get qualified.
proactively planning,
Mhm.
I may be planning for the future need of
Sure.
Medicaid
Correct.
or the future fact that I'm not going to get Medicaid.
Right.
And,
Mhm.
different.
Like we advocate for care, notwithstanding the payer source. It doesn't matter. It's not
Mhm.
just Medicaid,
Right.
right? So our clients would come in, if they're going to privately pay for care, they could still benefit from Connie's
Of course, right,
services.
yeah.
Right.
So it's
Medicaid
not-
is just like a little
Medicaid's
piece of
just-
the puzzle.
Medicaid's
Yeah,
just
right.
the payer source.
Yeah, I mean,
Right.
Medicaid is a way to finance.
Exactly.
Yeah,
It's not
exactly.
the only way. And in
Exactly.
Medicaid's perspective, it's the last way.
Right, right.
Well,
right.
and I think frankly, like in some cases, I believe, and correct me if I'm wrong, that there are certain institutions you can go to with Medicaid, but then there are others that don't want you if you're Medicaid.
Well, that is a big misconception that
Is it?
people
Mhm.
have.
Okay,
That maybe in
that's why
other
I said-
states,
Mhm.
but like in New York, every skilled nursing facility takes
takes
both
Medicaid.
private pay and Medicaid. Now, do they prefer private pay? Sure, because they get more money, right?
Right.
It's a higher rate. But and if they had two potential patients coming in at the same time. One was strictly private pay and the other was Medicaid as the payer source, kind of everything else being equal, who are they taking?
Mhm.
Yeah.
Right.
Yeah, I
Private pay
mean, they have
patient.
the option of accepting who they want
Right.
as a patient.
Right.
Right.
So they're going to take the private pay patient first,
Right.
But all nursing homes
but they
accept
all
Medicaid.
accept
Right.
both.
And assisted living,
Very,
No,
very few. There's
Medicaid.
just a few that accept
That are
Medicaid,
Medicaid,
that
yeah.
have Medicaid beds.
Right.
Just a few.
right. And you better be financially solid.
Yeah,
Again,
it's-
we got family who had to go through, the wife had, and she's no longer here, but she had to go to a memory care unit. The husband moved in with them. And I'm not going to mention the name because it doesn't matter, but
Right.
$15,000 a month
Yep. Easily.
for the two of them to be there.
Yeah.
So you better be
That's where when planning isn't done properly,
right.
a spouse could become destitute paying for, the other spouse's care.
Yeah, I
and
mean, and
whatnot.
that's a direction that somebody may have to think about. That's where they're going to end up.
Mhm.
But that's why if we can put a plan in place in the home
Right.
with the support and care that they can afford now, and whether they start out as private pay, let's say,
Right.
for care in the home. And as we know, it's very costly.
Mhm.
So then they're working with us to figure out, okay, how can we do this more long term? And then we do apply for community Medicaid. We continue to work with them to make sure that they have the maximum amount of support possible in the home so that they can afford to still
Well, that's a
live
good
there.
one too. I mean, the thought about, okay, in-home or outhouse, if you will, all right?
I like that phrase. I don't think the nursing industry would like that.
I don't know if they're going with that
But,
slogan.
That's
Some
pretty,
cases it's like a-
that's not a Freudian slip, as they say, right?
Like, okay, everybody's conscience says they want to keep whoever they love home, all right? But my personal feeling is that there certainly is a time, my mother lived with us for a long time. And we got to a point where you needed a Hoyer lift and you needed all kinds of
Correct.
stuff to function.
Correct.
It was time, that
Correct.
we had to do something.
Correct. Home
Um,
is not always
Yeah, it's not always
the
the best
best
option.
place.
Right.
So that again, and
Mhm.
I have to say the social work perspective, I'm working with the family, looking at the circumstances. It isn't one size fits all.
Right.
Sometimes, we really want to be home, but it may not be the
No.
best option. And other times, being in an institution for that particular individual wouldn't be the best option.
Mhm.
So we have to look at the person, what works best for them, and how could we make that happen?
Yeah,
Yeah,
and
I
I think
mean-
understanding it, and that's why it's so important to have the social worker because it is a very difficult thing, right? I mean,
Mhm.
we've all been there. We've known people who just want to stay home, but it's not safe for them.
That's
I mean, they're
right.
living thing. So it's very hard as the family member to express that you have emotions involved and all
Mhm.
these things. So having a social worker be involved in that process and helping them understand that and get them to where it's
Well,
best for
maybe
them is so huge.
the in-home caregiver has their own problems.
Right. No,
Yeah.
exactly.
Uh,
There's so many
But
layers
by
to
having
all
the
these
social work
things.
piece, even if they're home for a while, we can help to ease the transition
Yeah,
to
right,
another,
absolutely.
supportive
Yeah.
care environment. And again, it could be assisted living, and maybe
Yeah.
that person's isolated and lonely, and they're not getting the stimulation that they
Right.
need at home. And sometimes it is better for them
Yeah.
to go. Well, maybe they have to go some day programs, or maybe it's going to be
Mhm.
assisted living.
And
So,
the
but
other
we look
thing
at
is
all that.
Like in the social work world, everybody's personality is different. Some
Yes.
people really will not thrive I know,
Exactly.
again,
Mhm.
somebody in an assisted living environment because they don't mix. They stay in their room, so they might as well stay in their room at home, to be blunt about
And
it.
there's so many different scenarios. Adult children that live out of state.
Mhm.
Is it a married couple? Did now one in the couple pass away? Now that individual, children scattered across the country, now they start to get involved. And they didn't even recognize the surviving parent had any kind of cognitive issues. How do I tell my mother she has to do this? I can't.
Yeah.
It's very difficult.
No.
It takes time
Mhm.
to work with families to be able to help them. They're going through a transition of caring. You go from being a child or a spouse to being a caregiver.
Mm.
My goal always is to keep you as that spouse, to keep you as that adult child, get services in place so that caregiving is not your only role now.
Yeah, well, you probably then get into some family dynamics that's not all that
Yes.
simple either.
Yes.
Never.
Yes.
I'm just kidding.
Never simple.
I'm exhausted just thinking about it.
You know,
I've heard.
sometimes we deal with a really difficult emotional situation, and we will walk out of the room and say, "Oh my God, that that was the hardest situation ever."
Yeah.
And then the next day, there's another one that's like, "Well, that just topped."
You're
the
like, good. Didn't think we could do it, but we did.
Right.
Yeah.
And that's when I say to Wendy, okay, Wendy, we need to process this because it is very emotional
Of
for us.
course.
We are dealing sometimes with very difficult cases, and the family is so distraught. We have to make sure we don't take that home with us. So I have to make sure that we're
keep that up for
processing.
her because she loves to talk about processing.
She was just dying to,
she was dying to get that in.
But it's true. You
It's
have to
very
take
true.
that time to
It's really-
process.
It is really a really profound benefit of having a social worker
Absolutely.
on my team, so we can do that.
I know we
'Cause
left.
Otherwise, we would take it home and then we'll kick the dog and yell at her. No.
Because I will give a shout out to Paula Ewell, who is my right hand
I
man,
love
and
Paula.
we're the social workers in the office, and we left because Paula just constantly has like a revolving door of staff just to come in and like just to process things with her, and it really is such a beneficial thing to have, because it's everyone, you guys are doing really important things, and it's tough, and especially when you're dealing with a senior population, you're just like it's a lot of layers. Certainly.
How did the two of you hook up?
I can't tell you that.
How many years do we know each other?
We probably know each other for
Like close to 10 years.
close to 10 years.
Yeah.
I mean,
I was working at the JCC.
right, and we were supporting the adult day programs at the JCC. And I used to joke with Connie, when you're ready to retire from the JCC, you got to come, you got to work with me.
So you basically retired from the JCC?
Yep, 3 years ago, and said, I'm ready for my new adventure.
Yes,
Yeah,
she
I
retired.
retired 20 years ago.
We all laugh because everyone's on this show, especially it's an ongoing theme. Our director over there too retired and then somehow is still here.
Well, we call it rewirement.
Yes.
I like that.
I like
Otto's
that
got
very
a whole
all
list
about,
of great little
semantics.
Well, I
catchphrases.
mean, to me, that's important to do something. If you don't do something,
Well, I
clearly.
love the work that
well,
I do.
That's what I was literally
So,
just
and to
gonna
work
say.
with
Yeah.
Wendy,
Yeah.
it's like I feel like I'm semi-retired
Yeah.
actually.
And she says that all the time to people. I'm semi-retired, so can I give you a semi?
I was
that's good.
We
No,
don't
you
Right.
can't.
No, I know.
What I also saw.
So now the secret is out.
Secret's out. The secret's out. No, we love what we do.
But
yeah.
being in this field, and I was looking at, questions and material you sent over that was so good was, what do you guys see is like a major need or is missing just from aging in place and trends? We're always trying to discuss those on the show. What would you kind of hone in on?
So there's a lack of professionals working in the field of geriatrics. And we need more geriatricians, we need geriatric social workers, and the list goes on. And we don't have enough people working in the field, providing home health aides. There's a lot missing. So now I'm going to turn it over to Wendy because in seeing this challenge, we could all identify the challenges, but coming up with solutions
Right, is
to
the hard
me
part. Yeah.
is what makes
Mhm.
Wendy stand out. So Wendy is the creator of the
So seeing that need and the struggles and the challenges, and seeing the success of our of the business model per se, it's like I want to bring this into academia because that's where it starts, right? We need to educate social workers and law students to work together, right? So if we could educate them in this model and they could learn to work together and collaborate and understand that, one profession is not more important than the other. They're put them on an equal playing field, educate them about this, and incentivize them to want to go into geriatrics and gerontology. So I created two scholarship programs, fellowship programs, one at Adelphi University, which I know is near and dear to your heart, and it's ours too. So it's the Goidel Gerontological Fellowship Program. It's a mouthful, and it's in its third year, and we we sponsor and fund it and help and do field placement. So
Mhm.
we're encouraging master's level social work students
Second year students.
to go into the field. So they take a years long, courses in geriatrics and gerontology. They have field placement in various in agencies and whatnot. But we've had interns and
Every year.
and they're so fortunate because they get their field supervision from Connie.
Absolutely.
So we're trying to shape them and mold them into and hopefully increase the workforce out there to get people.
Yeah,
to
and I
wanna
think it's
go
like, and
into
that's
it,
what's so
right?
special about those kind of internships because, going through it, that's when you really, there's things that you realize that you really like, right? You're like, I didn't even know would be included in this, and it opens your eyes to so many things that, because I know, listen, being in there, we were talking off air about it, and I always knew that this was the population I wanted to work with. Most of my friends wanted to work with little kids, and which seems to still be kind of the ongoing theme. And I think it's so important to really, the education is the first step to this because, you open people's eyes to, how big of a world it is really doing. You're not just dealing with, a senior and like you go, I don't want to do that. There's so many layers to this. And I think what you're doing, is just so, so great.
30 years ago, I wanted to work with kids
Yeah.
and I wound up, my first job was working with seniors and I fell in
Yeah.
love and that was it. I
Yeah.
never wanted to go
Right.
back. So I agree with you. Once they're exposed, and
Yeah.
that's this internship program at
Mhm.
Adelphi, they're exposed to this population in different ways and seeing that there are other opportunities within the field of geriatric social work. And we've had interns that had no idea, came in not ever wanting to work with the elderly and now love it.
Yeah, right.
So it's so important what Wendy's doing.
I mean, I think it requires, my granddaughter for a while was involved because she did some internship, I think, with Meals on Wheels. And, but then she ended up getting, fortunately for her, a job as a social worker in a school, which now you're dealing with another level, not completely children, but could be lots of problems.
But you could be dealing with older people too,
Right.
parents,
Yeah.
grandparents,
Exactly,
right? So
right.
you have to know how to.
But I think older people, frankly, is probably more complicated. And this is my view as an older person, viewing other older people.
But I will tell you, my son is also a social worker in a high school, and he has given us many referrals already because, again, we're dealing sandwich generations.
Right.
So you have these high school kids whose parents are dealing with their parents and they need support.
Right.
Let me get your contact number so we could let our listeners know what's the best kind of contact number for you.
Our office number is 631-390-5600. That's, we have someone will answer the phone from 9 to 5 every day. They could also reach out to us on our website, which is www.goidellawgroup.com. There's a way to contact us through there too, but we love the phone calls.
Yeah, I mean, it's just really just such an incredible service. And I think that everyone listening, it's, is probably having those light bulb moments like I did, like, it just makes so much sense, to combine these two worlds together. So it's, I'm really excited. Otto, you'll be happy to know they're going to be doing a presentation for all of our social workers.
That's good.
And, we're going to hopefully have them at our advisory too. So you will have an upper hand when they do their presentation.
I wind up, because I'm involved with Project Independence, people who are friends or have parents or whatever, I end up getting phone calls about like, I'm supposed to know what I'm talking about.
Well, he is our ambassador. We call him our ambassador.
But what is more important is many times I'll contact Project Independence and try to get an opinion about something,
guidance,
whatever the issue might be, like I'm big on seniors getting involved with technology, try not to deny the fact that this is here to stay. And if you don't function with something like this thing, you basically going to be doing nothing.
Yeah.
The whole world revolves around the phone.
Well, and that's
Yesterday,
that's
my phone stopped working because of a conflict with my hearing aids. And it was like
He's like, but that's a story for another day.
right?
But I would like to thank our guests so much today, Wendy Goidel and Connie Wasserman, for such important information. It was such a pleasure pleasure to have you on. And you guys nailed our first episode of 2025. So thank you so much. I'd like to thank everyone who listened to us. You're listening to Project Independence and You on LIU Public Radio.